Good morning, everyone. We're from SGDB7, the fourth semester of PSSK 2021. Today, we will present our student project presentation, which title is Hypoglycemia During Traveling. Next. These are our members. Next. We will start with Chapter 1 Introduction. Next.
Good morning. My name is Gregorius Thongiratama with the last digit of student number 085. Now, I'm going to explain about the background of our student project. Hypoglycemia, as an abnormally low plasma glucose concentration, is a medical emergency that needs to be treated immediately because it can lead to organ damage or even death abruptly. Hypoglycemia frequently happens in someone as a result of diabetes condition. Among diabetes patients, travelers are classified as vulnerable to hypoglycemia because of altered lifestyles during traveling and careless offering to medication. Considering the risk and tendency of traveler with diabetes to experience hypoglycemia, there is a need to be a study that provides detailed information about hypoglycemia during traveling, which will be beneficial in reducing the chance of worsening conditions of patients with diabetes. That's all from me, and thank you.
Hello everyone, my name is Natania Sutedja with last digit of student number 175. Next. Okay, so this is the problem formulation of our student project. The first one is, what is the definition of hypoglycemia? What is the epidemiology of hypoglycemia? What is the etiology and risk factor of hypoglycemia? What are the signs and symptoms of hypoglycemia? What is the pathophysiology of hypoglycemia? What are the classification and diagnosis of hypoglycemia? What are the correlation between hypoglycemia and traveling? What are the management of hypoglycemia during traveling? What are the prevention of hypoglycemia during traveling? What are the complications of hypoglycemia? And what is the prognosis of hypoglycemia? Next. So these are the objectives of our student project. The first one is to understand the definition of hypoglycemia, to understand the epidemiology of hypoglycemia, to understand the etiology and risk factors of hypoglycemia, to understand the signs and symptoms of hypoglycemia, to understand the pathophysiology of hypoglycemia, to understand the classification and diagnosis of hypoglycemia, to understand the correlation between hypoglycemia and traveling, to understand the management of hypoglycemia during traveling, to understand the prevention of hypoglycemia during traveling, to understand the complication of hypoglycemia, and to understand the prognosis of hypoglycemia. Next. So these are the benefits of our student project. It benefits to the writers, institution, and public community. That's all from me. Thank you.
Okay, next. Okay, good morning, everyone. My name is Ledwin Wibisono with the last three digits of student number 061. Next. Now I'll explain the definitions of hypoglycemia. So according to the American Diabetes Association, hypoglycemia is a condition when the blood glucose levels in the body reach below 70 milligrams per deciliters. And hypoglycemia frequently occur in diabetes patients as the result of the acute complications of diabetes mellitus. And the signs and symptoms of the hypoglycemia may not appear until the blood glucose level reach below 55 milligrams per deciliter. And but however, the hypoglycemia can also occur in non-diabetic patients. So several factors such as change in someone's diet, exercise and activity levels, environment factors, especially during traveling, can contribute to the hypoglycemia in non-diabetic patients. So therefore, hypoglycemia is a serious medical emergency that requires immediate recognition and treatment to avoid organ damage and death. That's all from me. Thank you.
My name is Karralika, the last digit number 246. Now I will explain about the epidemiology of hypoglycemia. Based on the data by international organizations, there were reported as people in 2009 diagnosed with diabetes and this number is predicted to increase. Hypoglycemia often occurs in regions with type 2 diabetes based on the lifetime conditions for diabetes. For perhaps taken diet and age. Yet, 144 of the 290 diabetic patients have hypoglycemic, and according to a research by CDC, there were reportedly an estimation of 245,000 emergency department visits for hypoglycemia in 2014.
Okay, let me introduce myself. My name is Putu Wijaya with the last digit of the number 227. Next slide. And I would like to explain more about the etiology and risk factors of hypoglycemia. And I would like to split it into two different parts, the common ones that can affect people in general, and the ones that target travelers specifically. So the common one, as you can see on the left side of the slide, are as the following. Diabetes medications, such as insulin and sulfonylureas, skipping or delaying meals, fasting or starvation, stress and lack of knowledge regarding diabetes, impaired counter-regulatory responses to hypoglycemia, hypoglycemia unawareness, and certain health conditions such as liver or kidney disease, hormonal disorders, and pancreatic tumors, especially insulinoma. Meanwhile, the ones that target travelers, as you can see on the right side of the slide, are as the following: change in meal patterns, excessive physical activity, time zone change, airplane travel, incorrect medication change, insufficient food consumption and limited access to healthy food, lack of familiarity with local foods, non-adherence to medicine, and excessive alcohol consumption. I would like to note that the risk factors for hypoglycemia on traveler may depend on the frequency and distance of travel, as well as the condition of the travel destination. That's all from me. Thank you. Next slide.
Hello, my name is Devi Prastiti with last three-digit number 028, and I would like to tell about the signs and symptoms of hypoglycemia. Next. Hypoglycemia could cause two kinds of symptoms, which are neuroglycopenic and autonomic symptoms. Neuroglycopenic symptoms is caused by direct deprivation of glucose to the central nervous system, which can cause confusion, drowsiness, speech difficulty, incoordination, abnormal behavior in children, blurred vision, and could lead to death if not immediately treated. For the autonomic symptoms, it is caused by the involvement of sympathoadrenal system. By the adrenergic, it can cause tremors, palpitation, and anxiety, or by the cholinergic, it can cause hunger, diaphoresis, and paresthesis reaction. That's all from me. Thank you.
My name is Ariela Rahardjo with last digit name 247. Now I will explain about the pathophysiology of hypoglycemia. Next. Impairment in glucose counter-regulatory hormone response to hypoglycemia. Complete absence of insulin may lead into three conditions such as no decreased number of insulin, no increased number of glucagon, thus may directly lead to hypoglycemia, and another condition is type 1 diabetes mellitus through defective method of insulin replacement or excessive insulin that may indirectly cause hypoglycemia. Due to hypoglycemia unawareness and defective glucose counter-regulation, it may cause further complication, for instance, deficient autonomic, including adrenomedullary response. Then, it may lead to decreased number of adrenaline, which is normally used for increasing glucose, and sympathetic nervous system impairment. Patient with hypoglycemia become asymptomatic. Therefore, the diagnosis and treatment delayed or done in late stage. I guess that's all from me. Thank you.
Okay, thank you for the opportunity. My name is Wilbert Purnamsidi with last three digit of my student number is 135. And now I will explain about the classification of hypoglycemia. Next. Okay, so hypoglycemia. It has three levels of classification. The first level, it's also called glucose out value, with the blood glucose level is below 70 milligram per deciliter or less than 3.9 millimole per liter. The next one is level 2, or clinically significant hypoglycemia, with blood glucose level is below 54 milligram per deciliter or less than 3.0 millimole per liter. And the last one is level 3, and it's also called severe hypoglycemia. This level doesn't have any specific number of the blood glucose level, but the main symptom of this level is severe cognitive decline. And this level requires immediate assistance from outside the body for recovery. For example, give the glucose, or maybe if the hypoglycemia, the blood glucose level is below 54 milligram per deciliter, we can give glucagon to save the patient, to help the patient to increase the blood glucose level. Maybe that's all from me. I give it to my friend. Thank you.
Hello, my name is Marta and my last digit of student number is 064. Now I'll talk about the correlations between hypoglycemia and traveling. Next, there are several factors that can contribute to hypoglycemia while traveling, such as first, changes in time zones. When traveling across time zones, the body's internal clock may not adjust as quickly as the external environment, leading to inconsistent meal and medication schedules, especially for diabetes patients who take insulin or other blood sugar lowering medications. If medication is taken at the wrong time or if meals are skipped or delayed, blood sugar levels can drop too low. Second, changes in diet. When traveling to different regions, it's common to encounter new foods and eating patterns which can disrupt the body's normal response to insulin. For example, meals that are high in carbs or sugar can cause blood sugar level to spike, while meals that are low in carbs or high in protein can cause blood sugar levels to drop. Third, physical activity. The risk of hypoglycemia during physical activity can vary depending on factors such as the intensity and duration of the exercise, the type of exercise, and timing of meals and medications. That's all from me. Thank you.
Thank you for the opportunity. My name is Jennifer with last three digit of the number is 101. Now I will talk about the management. Next. Hypoglycemia can occur in both diabetic and non-diabetic individuals, and its management depends on the underlying causes. For this case, it is recommended to eat smaller meals regularly and include 1 or 2 snacks throughout the day. It's also important to avoid sugar-rich foods, alcohol, and caffeine. Additionally, any medication that may cause hypoglycemia should be discontinued. On the other hand, the case of diabetic hypoglycemia, immediate action is necessary to raise blood sugar levels. Following the 15-15 rule, patients should consume 15 grams of fast-acting carbohydrates to raise their blood sugar. After 15 minutes, the blood sugar should be checked again, and if it remains below 70 milligrams per deciliter, another 15 grams of fast-acting carbohydrates should be consumed. In severe case of hypoglycemia with blood sugar levels below 55 milligrams per deciliter, injectable glucagon should be administered. If the patient lost consciousness, they typically regain consciousness within 15 minutes after the injection. However, if they do not wake up within this time frame, a second dose should be given. If the individual is conscious and able to swallow, a quick-acting sugar source such as fruit juice or a regular soft drink should be provided, followed by a long-acting sugar source such as cheese and crackers or a meat sandwich. It is very crucial to educate those around individuals with diabetes on how to test blood sugar levels and also address hypoglycemia promptly, especially when they are traveling. Thank you.
My name is Putu Putri with last three digit number 027, and I will present about the prevention of hypoglycemia during travel. Next. So pre-travel consultation is one of the key signs in preventing hypoglycemia. Consultation increases patients' awareness and knowledge regarding the impacts of traveling on diabetes and allows patients to prepare for a health concern that might arise during travel. Diabetic patients should consult their physician 4 to 6 weeks prior to their travel. During consultation, physician will determine whether the patient need modification in insulin or oral medication regimen. Diabetic patients should also keep a glucometer, oral medication, and insulin in an easily accessible luggage throughout the duration of travel. Simple carbohydrates such as glucose, tablets, gels, or candy or to relieve symptoms of hypoglycemia should also be prepared. Furthermore, patients should maintain adequate hydration and check for blood glucose every 4 to 6 hours. In condition that patients are traveling by plane, the airline should be informed about the patient condition at least 2 days prior to their travel. In addition, patients should also keep a medical document from their physician that states their condition. Thank you.
Hello, my name is Felix Djuanda with the last digit of the number 117. I will continue the presentations. I will explain about the complications. The complications is mainly about the untreated hypoglycemia. Its first one is acute coronary syndrome through temporary focal deficits, memory deficits, arrhythmia, endothelial dysfunction, and coagulopathy.
Hello, my name is Kusuma Mulya with the last 3-digit number of student ID 1 and 51. Here I would like to present the prognosis of hypoglycemia while traveling. Okay, so the cause, severity, and duration of hypoglycemia all affect the prognosis for this disorder. The prognosis is excellent if the source of hypoglycemia is found and addressed quickly. Meanwhile, the long-term prognosis is poor if the issue cannot be fixed. Complication of the hypoglycemia while traveling sometimes occurred in patients can be worsening the mortality and morbidity, such as diabetic travelers who go abroad with more than 6 hours of trip can enhance the probability of cognitive impairment or dementia, falls, traffic accidents, and or other travel-related injuries. Next slide, please.
Okay, hello everyone. My name is Natania Sutedja with the last digit of student number 175. Next. And this is the summary of our student project. So hypoglycemia is the condition when blood glucose level in body reach below 70. And it is depending on the underlying causes, and it can make symptoms, two types of symptoms. There are neuroglycopenic and neurogenic symptoms. And there are three levels of hypoglycemia. The first one is when the value of blood glucose is within 54 to 70, and the level 2 is clinically significant hypoglycemia with a value of less than 54. And level 3 can be called severe hypoglycemia, that is characterized by severe cognitive decline and requires immediate assistance from outside of the body recovery. And hypoglycemia during traveling can be caused by changes in time zone, changes in diet, and physical activity. And there are a few complications of hypoglycemia, includes acute or coronary syndrome, stroke, focal deficit, memory deficit, arrhythmias, endothelial dysfunction, and coagulopathy. Next. And this is our recommendation about hypoglycemia during traveling, which is further studies by scientists and researchers are crucial to gain more knowledge about hypoglycemia during traveling and public understanding about the symptoms for early detection. Next. So that's all about our student project about hypoglycemia during traveling. Thank you very much.